The best way to scan the gallbladder and the bile duct is to scan the patient in the morning, because after a fasting period during night, the gallbladder is totally full and there is no bowel gas which interferes with the ultrasound. You don't need any special position for the patient. If the patient is lying in a supine position, as you can see it here, the gallbladder and the bile ducts are scannable very easily. In this case, we are using a handheld ultrasound device, as you can see it here. The probe has two sides, the linear side and the sector. For the abdominal scan, we use the sector scan. For the orientation, the probe has a light or a notch, and for the longitudinal view, you position the probe onto the abdomen of the patient when the light or the notch is showing to the head of the patient. Now let me show you how to visualize the gallbladder in the longitudinal and transverse orientation. At first, we put some gel onto the ultrasound probe and position the probe in the longitudinal orientation just below the ribs here. You see that there is kind of a folding visible in the gallbladder. That is a very common finding and not a septation. In the longitudinal orientation, it is very important that you tilt the probe laterally and medially to visualize the entire gallbladder. You see the gallbladder wall is very thin. It is only one thin echo-rich layer, and there is no structure visible inside the gallbladder. Turning the probe 90 degrees counterclockwise into the transverse orientation gives you the transverse view of the gallbladder. Again, it's very important also in this orientation to tilt the probe cranially and caudally to visualize again the entire gallbladder. A great view to visualize the entire gallbladder is the intercostal oblique view from that position. Here you can easily visualize the whole gallbladder from that intercostal oblique position. Again, tilt the probe cranially and caudally to visualize the whole gallbladder. When tilting caudally, the right kidney comes into the image field. Here, the whole gallbladder is easily visible with the thin echo-rich wall without echogenic structures inside the lumen of the gallbladder.